Hi, I'm Jess. I suffer from severe allergies, including an airborne nut allergy. I carry adrenaline pens and have experienced anaphylaxis. I'm going to tell you a bit about it. I developed several allergies growing up. As I got older, they got worse until one day I ate something with coconut in it and went into anaphylactic shock for the first time. So basically, for me, first of all, my heart gets loud in my ears and my skin swells and it goes very red. And then I start to shake uncontrollably and then I start to cough. And it is at that point, there is no return and I have to take my adrenaline pen. From that point, if I don't take my adrenaline pen, my throat will close and I will start to find it extremely difficult and eventually not be able to breathe. So, there's two stages. Firstly, there is the adrenaline. Now it's really important to realise adrenaline is not a treatment. It is a stopgap. It is a way of giving me time to get to hospital. It is not a case that you take adrenaline and you're fine. So they give me adrenaline, great. If it doesn't work, second pen, then the paramedics arrive, take me to hospital, and then they will give me a very strong antihistamine and monitor me for about 6 hours. If I'm lucky, I will not slip back into the reaction and I'll be able to go home and then have a couple of days rest. So biphasic reactions are where you can slip back into the reaction. That can be half an hour afterwards, that can be hours afterwards. Sometimes, if you're really unlucky, it can be days afterwards. So for the few days after you've suffered anaphylactic shock, it is really important to take everything really easy. Hospital will give you a spare EpiPen if you don't have one. And normally it's advised that you go and see your GP a few days after and they will just check you over, see how you're doing. So the big one when you're treating somebody in anaphylactic shock is don't panic. Firstly, because that person is trying so hard to stay calm. It is really difficult when you can feel your body shutting down to stay calm. So if the people treating you or around you are panicking, it makes that little bit more hard. Secondly, this person who's suffering anaphylactic shock probably has a lot more experience of it than you do. So yes, you are in a fantastic position to help them, you really are, but also listen to them. If they can't talk, ask them questions, ask them if they have medication they want to take, ask them if they need help with their EpiPen. But 9 times out of 10, they will know what they need, but they might not be able to communicate it effectively. And the third thing is if they can't talk, don't treat them as an unresponsive casualty. We're not unresponsive. We know what's going on around us, but for example, for me, I find it incredibly difficult to get a sentence out because I am shaking and gasping and I'm trying so hard to breathe normally. But I do know what's going on around me, so please don't panic, don't freak out, don't worry. Just stay calm, take my adrenaline, write down what time I've taken it, and then the paramedics will get there and it'll all be fine. So my biggest concern is being unconscious. And in that situation, people not either not giving me my adrenaline, I wear a medic alert, a lot of other allergy sufferers do, and it says on here what I'm allergic to. I have an EpiPen in my bag, well I have 2, please give it to me. But please give it to me correctly. All adrenaline devices say on them how they're to be used, okay? They're really easy to use. Stab me in the outside of the leg. None of this Pulp Fiction nonsense. Straight in the outside of the leg. Yeah, anaphylaxis is scary. I'm not gonna sit here and say it's super easy, but it is treatable if you treat it straight away. Now I suppose you could say lucky in some ways that I know my symptoms backwards, so I know when I need my EpiPen. But if you have a friend who's maybe never taken their EpiPen, and you can see they're going towards a bad reaction, encourage them to take it. If they can't take it themselves, help them take it. Call them an ambulance. It's so important because sometimes the people who are most scared of taking it is the allergen sufferer themselves. So be supportive, be helpful, don't panic. And above all, you have a really unique chance to help that person in that moment. So don't worry, you won't see a needle, there won't be blood everywhere. It's one of the most simple things you can do. but please just help somebody take their EpiPen, or make sure that they've got everything they need and that they're settled and comfortable and they've taken any medication, and sit with them until paramedics arrive, because it's scary, but you can help them, and it's such a simple thing to help them to do. No, it is not. So, when you are first given an EpiPen as an allergen sufferer, doctors and nurses tend to go, this is how you use it. If you're nervous, you can order training pens for free from any, so there's 3 main types, Jess, Emerald and EpiPen. If you go onto their websites, the manufacturer will send you practice pens for free. So if you're nervous, you can do your own training with your friends and family and say, this is how you use it, but you do not need medical training. You will not get in trouble either if somebody is unconscious and you administer their EpiPen for them.